Now, the average time, I think, from our base to, say, Baptist Regional, I think it's about a 6 minute flight for a helicopter. We'll get on scene. Ideally, we try to keep our what we call scene times less than 10 minutes. We'll come in. Normally, fire departments, they'll set up what we call LZ. It's normally about a 100 foot by 100 foot area just to make sure there's no obstructions, where we can safely land the aircraft, no debris get into the blades, nobody walking into the blades. We'll get on scene, quickly evaluate the patient, do any immediate life-saving measures that need to be performed at that time. On the helicopters and the plane as well, we can do a few procedures that the ground crews can't do. The ground crews around here do an outstanding job.
Right.
But there's a few things that licensure-wise they're not allowed to do that we're allowed to do. A big thing is advanced airway management that we can do that they can't do, but we'll get there. If they have to have some sort of advanced airway management, some life-saving measure that's beyond the scope of the ground crews, we'll do that real quick, and we'll get them in the air and towards the facility. Ideally, we try to keep those times under 10 minutes. Sometimes there's extenuating circumstances. If you're in a bad car wreck and they have to bring in what they call the jaws of life traditionally and extricate you from the car, that may take a little longer to get you out of there, but ideally we try to keep it within 10 minutes and then launch. And then depending on where you're at, we always look at the closest level 1 trauma center, which is where most of the patients are taken to. From our location here in Corbin, the closest level 1 trauma center would be the University of Tennessee. But if for some reason there's weather that prohibits us from going to University of Tennessee, then we would look at Lexington and so forth. You always try to go to the closest trauma center. Average flight time is probably about 30 minutes to one of those.
People don't realize the life and death situations that you endure and encounter, and it really takes you guys being a professional and on your game,
Oh, it does. We work really hard at it, and AirEvac gives us the tools we need to be successful in this. We fly a pilot, a paramedic, and a nurse team, and it gives us a good mixture of care. Of course, the pilots know all the aviation stuff, and there's real strict guidelines of what a pilot has to meet in order to fly EMS, over 2,000 flight hours, instrument ratings, and so forth there. The nurses, we require about 5 years of experience for our nurses in either ER or critical care setting, and the same thing with the paramedics in a high volume 911 setting. And with the nurse paramedic team, that kind of really gives us the perfect storm per se with it, because the paramedics' focus is out in the field, a lot of advanced airway management, doing these car wrecks and so forth.
Right.
And the nurses has an extensive hospital background, and they're more comfortable, well, not necessarily more comfortable, but used to titrating drugs and so forth, infusions that will be on. And when you combine that team together, now you kind of got the best of both worlds, so we can kind of go into about anything and really be prepared for it and have a strong background in both areas.
Well, how does it work? Like 24 hours a day? Like if somebody calls you at 2 in the morning or 3 or?
Yes, we're available 24 hours a day, 7 days a week, 365 days a year.
Wonderful.
To take transports, and there's always variables there. Weather is a big thing that you'll see that may prohibit transports. But now with the fixed wing we've added, and I think we're coming up on our second year of having the fixed wing in Williamsburg. That helps out a little bit with that, because now we have the ability with the fixed wing, you can fly IFR, which is instrument flight rules. And just like the big airliners, if you're going out to California, New York, or somewhere where you'll file a flight plan, we'll file a flight plan with the FAA. We'll shoot the approaches. We can actually fly up in the clouds and rain and so forth, and then shoot an approach and land at UK, or not UK, but rather in Lexington, take the patient over to UK, or land in Knoxville at McGee Tyson and go over there and by ambulance. So that really opens up as a great asset we've added to this community.
Exactly right. And these pilots are so highly professional. I've watched some of the helicopters land right on the main roads and things like that in dire situations.
Oh yeah, that is it. And I've talked to them. I've worked with a lot of pilots over the years. We have a lot of pilots that were born and raised in this area. Great guys I've had the benefit of working with, and it's unbelievable the training they go through, and they do stuff so rapidly. You talk to these airline pilots, and they're used to having quite a bit of time to to prep and get their flight plan in, look at weather and stuff, and they are doing stuff so rapidly and in a very professional, safe manner. We're off the ground within 10 minutes of receiving a call. They've checked weather, filed a flight plan if they need to, got in there, did the walk around, and in the air. And you'll talk to some pilots that have been piloting commercially for years, and they're like, man, that's unbelievable how fast you guys did that, and did it professionally, did it safely. And then, and to come out into these areas, airports are they're nice. You don't normally have a lot of changes at the airport. It's normally a consistent flow, but you get these EMS helicopter pilots. A lot of times they're landing on scenes. It's the first time they've ever seen this area. It's not like flying into an airport they went into several times, and there's a lot of stuff that has to go into that. They have to do recons, and then they're looking for wires, trees, anything that could possibly strike the aircraft, because the last thing you want to do is strike something like that. It could be a catastrophe.